Yeah, thank you very much. One of the things I wanted to begin with is just talking about what a digital twin is, because people have different definitions. When we talk about digital twins, in this case in healthcare, we're referring to virtual models of individuals that integrate physical biomarkers. It could also be mental data as well, by behavioral health, and then also demographic data. Like, what else could we know about human beings to sort of model out a person? And so these AI-powered twins can help personalize care. They can predict health risks. They can improve communication between patients and providers. There's all kinds of different ways that we could use this with throughout healthcare. And they're already being used for things like early disease detection and tailored treatments to individual patients. But it's important to clarify, in case you're thinking about digital twins, I came from the spatial computing space, like VR and things like that, where digital twins are often referring to 3D models of a building, or like you could do an operational simulation of a healthcare system or something like that. In this case, we're not talking about that. We're talking about the human side of things and digital twins. So I'd like to jump in. Maybe I'll go one at a time. And I think actually, LP, you're a good place to start, because your company, you're making digital twins. So can you talk a little about your background and how you're using them?
Excellent. Well, thank you. It's a pleasure to be here. So what we do at BioTwin is we create human virtual twin, and we're doing that based on several ways of doing it. We use it with a at-home kit. You pick your finger, a few drops of blood, and using AI, we'll track up to 200,000 different biomarkers, the metabolites to be precise. So one of the first clinical application is early detection of breast cancer and colon cancer. Actually, 4 different cancers that we're targeting. You mentioned my background. I'm not a clinician. I'm not a researcher or scientist. I come from a technology background, so I'm really come from the left field as an entrepreneur. And but I knew AI was going to have an impact, and that's what we've been applying it to BioTwin.
Okay, great. And next, I'd like to turn to Tina. Tina, can you talk about your role and where you see the potential for digital twins as being part of a larger strategy and other technologies you're seeing?
Sure. So I work with some of the largest healthcare companies in the country. And what I work with them on is mostly, how do you take the technology? So there's, as we've talked about today, a lot of technology, a lot of innovations that are coming, and they're coming very fast. So how do you take these technologies, these innovations that you know will create meaningful outcomes and benefit to humanity? How do you take that and scale them? And then which ones do you choose? And how do you how do you do that in a successful model? Because one of the things that I heard earlier, and I think we all agree upon, is that healthcare is a very individual and personal thing. And each of us are different. And so how do you there's a lot of great work that's being done around the country, around the world, but how do you take that and really scale it? How do you make meaningful outcomes happen? And so what we work with clients on is, how do you do that? How do you really see all the various individuals within a population, if you're talking about millions of people, and then how do you apply the right care at the right time? So something that was said earlier, I think Mala said it, about even detection of disease, and how do you do that? And how do you get the right intervention to the person at the right time? And a lot of people are left behind now because they don't, but the technology may be there, the innovation may be there. So that's what we work with. I work with clients on all the time. How do you scale these things? And something like the technology of a digital twin, personalization, personalized medicine, being able to model things beforehand, creating meaningful cohorts of populations of patients that then you can execute an intervention and create a care pathway for it that may be different than your standard population health model that we've used in the past. And so this technology is incredibly interesting, as well as, I think, transformative, if, like everyone has talked about, if it's used appropriately, if we're collaborating, if we have interdisciplinary teams that are coming together to see how do we actually execute on this.
Great, thank you. And next, Mary Sarah, I'd like to turn to you. One of the things that's really cool about this panel, from my opinion, is that people are coming from such different places. You've come from product perspective, you work with mental health. Tell us about your background.
Yeah. Hi, everybody. I even have notes, but I'm analog, but I'm also very digital. I'm a builder at heart. That's really kind of at my core who I am. I love taking teams, products, strategies, companies, and help them build, taking all these great big ideas that we have and have heard about and making them practical, both in terms of usage, funding, et cetera. I'm representing myself. However, I took a year off, which if you can do it, I highly recommend. And I completely unplugged, but now I'm plugged back in. But the one thing that I did stay with over the last year is I've had the great pleasure and privilege of serving as the board chair for Southlight Healthcare for 2 years. And this is what they tend to call the victory lap, my last year, where you stay on long enough for people to pick your brain on things, and then you get to ride out to the sunset. But for those of you who don't know, Southlight Healthcare is a behavioral health and substance use disorder recovery nonprofit. And what's amazing about this nonprofit is that we operate in the green, which is kind of amazing in this particular area. And working with Southlight has really just helped reinforce the way that I like to approach, and we should all be approaching thinking about these technologies. They're innovative. They focus very much on human-centered and patient-centered care. And they also deliver incredibly compassionate care, both to the patients who are coming in with mental health challenges and or substance use disorder. So I could talk for hours. I'm Italian and it's genetic. However, what I will say just to start is that there's a continuum of care where these technologies could be applied. As we go further, I'm happy to talk about very specific examples, but I generally say where can't an organization like Southlight or others use it?
Thank you. And then David. So David has joined us. He's the managing director of Cone Ventures. And can you tell us, you said you've been looking at digital twin companies to invest in, and you've been thinking about sort of what does that path look like? What are the things that make them investable? Where do you see the next steps moving?
Yeah, thank you so much. So at Cone Health Ventures, we take a little bit different approach. We're looking at the intersection of the health system's challenges, strategic priorities, market opportunities, and exceptional founders. Shameless plug, one of those founders is here today, Summer Stanley. Everybody needs her innovation, so please take her card on the way out the door. Absolutely, we support our partners. And with that lens, we're looking at applications of digital twins that really will produce ROI for the health system in the next 24 or 36 months. And although there's great promise in sort of the individual digital twins and what they can do for precision medicine and drug development, it's not quite ready to be integrated into the workflows of current clinical methodology. But what we do look at is sort of the population level of digital twins and behavioral economics, thinking about as you go and negotiate different payer contracts, what will it mean to change the copay or a price of a certain drug? And how will that affect downstream revenues, costs, healthcare outcomes along the way? Or even looking at changing our facilities, not 3D models, but the actual patients and the foot traffic. Where will they go, and how will that affect how operations are impacted inside the hospital itself as well? And so we've looked at a number of opportunities like that and are eager to look at more. We're also keeping an eye on more of the lens that you're working in, and trying to figure out when is the right time to start trying to integrate that into clinical workflows. A lot of that has to do, again, with the payer dynamics and the way those things are set up. It would be great if we could have a digital twin of an individual and skip right to the most effective medicine. The unfortunate reality is that's just not the way the contracts are made, and you have to go through certain tiers of treatment before they even let you get to some of those.
Great, thanks. And that's taking it to a different level, not thinking necessarily on the individual person's level, but thinking about populations, and you work with them again, which is another big application of digital twins, and one that I was at a company called Ultisim that also worked on digital twins, and was thinking about that at a population level for pharma companies, and trying to understand their customer and the persona there and how it changed, maybe with news changes and things like that, and how you could reach out to people from a marketing perspective. You mentioned, I guess we and this is the part we've done, everybody's gotten a chance to talk a little bit. So now I think we should, to have a big conversation, interrupt each other, follow each other's sentences, disagree. But I'm curious about your thoughts of where the challenges are. So I know that we had met before the panel a little bit. Heard LPU mentioned something around regulations as being one of the areas that make it a little more challenging here. But you're also working elsewhere, and then it's a little easier in that front. Do you want to talk about challenges you've seen?
Yeah, well, so right now we have offices in Quebec, Canada, but also in Abu Dhabi, where we've just launched with the Cleveland Clinic Abu Dhabi a validation pilot for breast cancer screening project. And it took about 2 months to launch the project, which if we'd be in Canada, it takes a minimum of 2 to 3 years to just get all the approbation before you generate the first samples, which in AI, you cannot wait 3 years. Not the expert on US, but one of the challenges we have with Health Canada, and I think the idea is a bit similar, is when you come with something very novel that has a lot of application, you need to come up with one claim. They're not necessarily looking at the big picture, which is something that's different again with the Department of Health in Abu Dhabi. They're actually the one pushing us. They're seeing the future. They're really aligned towards innovation. So it's easier over there to get adoption, and as opposed to what we've seen here.
Mm-hmm. Other people to weigh in on different challenges you've seen?
Well, one of the challenges that I'd mention is just overall with health AI in healthcare is transparency and explainability. So, traditionally, like you mentioned, you have a process for how care is delivered and how care is paid for in this country specifically. And a lot of that is based on research and evidence-based practice or medicine that is validated with a lot of research, right? So you need a lot of research, you need a lot of clinical findings to validate this type of treatment. And then there's a payment, or there's a there is a stage that you have to go through. With AI or with models, because sometimes you can't explain it, it's not completely transparent. A lot of people think it's a black box. There's this, kind of gap of, well, I don't believe it. I don't believe that we could cut from this piece, this stage here, all the way to stage 3. In the process, we have to go through all these treatments. We have to go through all this trial and error in this traditional manner. So I see that as a hindrance, although I do also see it as an opportunity. So when I think about, and I heard this earlier today, talked about just the black box in general of AI and being able to explain. And I know it causes a lot of fear for people, but I also see this as an opportunity that, why can't we figure out how to validate? Why can't we figure out how to govern and monitor the technology so that it doesn't take over us, and that we do have that level of transparency? I think that as fast as the industry is going, we're trying to keep up with it. But there is we are humans. We should be able to stop it at some point and say, this is what we have to establish in order to get there, because the result of doing that is so great. If we can figure out how we can validate, give trust, give people a level of comfort, and not have to rely on some of these antiquated processes that we already know we have technology that can handle it. But I see it as a barrier right now.
To add on, Tina, to what you said, one, I see a continuum of development of this technology. So for a split second, if you guys would at least abandon for a minute all of the barriers that we have and just think about the patients and what this type of technology could do for them in our future, there's a significant amount of upside. The one challenge that I see that is directly related to patients, and I think is an opportunity and more of a call to action, is the bias built in both the data and the models. When you think about mental health or you think about chronic disease stages, these are not always indicative of sort of our general population, right? Even though, frankly, it affects us all. These are marginalized communities, whether they're rural, whether they're socioeconomically disadvantaged, whether they're racially disadvantaged, gender, you name it. So digital twins will work when the data and the models work for everybody, because that's the promise of a digital twin, is that it's your twin. It's not Brian's, it's mine. So I would be cautious about that. But for me, that's the whole reason why I would dive headlong into it in an innovation and a research capacity, because it's going to be very easy for the payers. And I've been through 2 exits, so I completely appreciate what you're saying. So I'm going to just suspend that in my role here today, to be able to get ourselves to the point where you can show both the patient outcome as well as a cost outcome, and to come to somebody like Tina and say, this is not a black box. And it doesn't always have to be entirely deterministic either, right? There are tools. Give me some information from which I, as a clinician, can make decisions. It's an and both. So I see bias as a challenge. I see it as something that we need to work on quickly, because I think that begins to level the playing field and the trust and acceptance of any technology like this.
I'll just, I guess, pile on real quick. There does need to be a paradigm shift. We saw through the pandemic, this happened with telemedicine and payment parity for different modalities of care delivery. I think we're ready to see a similar sort of paradigm shift around AI, given this new wave of technology we're experiencing. And I don't want to, frame the payers up as some evil organization. We all have different skeletons in our closet, of course. Those rules exist for a reason, to protect patients, to protect against fraud, waste, and abuse. And when they were developed, they never foresaw this sort of technology being out there. And I think it's just a matter of time and raising our voices to get that changed. What I see as a challenge from my perspective inside the institution is this workflow integration. And it's not just for digital twins, it's for most new technologies. Clinicians are scientists by nature, and they're trained on specific processes through which they deliver care. And that's being challenged now through predictive analytics, AI that can skip over certain points of that process. And so understanding how and when to use digital twin technology in the provision of care, bringing physicians, young and old, along on that journey, I think is a challenge that no one company or entity can take on, but one that we all need to have our eyes wide open about if we do want to affect that change and have accelerated adoption, not just of digital twins, again, of any innovation as they start rolling out faster and faster and faster with the innovations we have around AI, computing power. I mean, they're just going to keep coming.
Yeah, so digital twins, like every technology, is going to come into a very complex environment that's happening in healthcare. The people, the technology they already have, the mission of what they're trying to do, the crises they're going through at that moment. And so it seems like a lot of things, what I'm hearing sort of from all of you as some sort of feedback mechanism. So if you've got something that was bad data going in, it had some sort of bias, there has to be some sort of way in which it's getting feedback coming through. And I think in an organizational standpoint, actually for my book, I interviewed Michael Levy for his work on innovation networks. And he mentioned Gilead and some of the work they're doing to try to source people who are closer to what's happening, the stakeholders, and pull that information with to build out new ideas that get vision and support from the top. And I think that's an amazing model of feedback. So I'm throwing that as a general conversational topic for people to jump in with ideas.
I think feedback comes in the form of certainly just a general overview and critique of what you're doing. But to me, the most effective feedback is when there is some use in the field and you're getting direct feedback from anyone who participates in that sort of life cycle of delivery. So to me, what I would focus on is ensuring that patients, payers, caregivers, clinicians are all part of the work, the experiment, and so that we gain feedback from every aspect of it. There should be quantifiable feedback. There should be statistical feedback. One of the things that in an innovation world you can do is learn very quickly and try again. And a digital twin is something that's incredibly well suited for that, because one of the reasons why they're built is to run what if scenarios.
You're right.
And so imagine that you're not necessarily experimenting on your patient, you're experimenting on their digital twin, but you have a patient who is willing to go through that journey with you. Yes, this is interesting. It's suggesting that I might benefit from X, Y, or Z. X seems most comfortable to me. Let's try that path. So I think feedback comes in usage, but it has to be usage across the board.
Well, I think also that for those that are purchasers of technology, so there's or at least in this country, the way that it works is that there's the purchaser or the payer of technology, and they typically control how it's disseminated to the masses, so to speak, or a large subset of the population. And those entities asking that question back to, so there's hundreds and hundreds, and I don't even know what the number is, but there's got to be hundreds and hundreds of digital health companies. And they will approach the payer or the buyer, the person that has the money, and with one-off ideas. And they do impact people. So not saying that your baby and the thing that you work really, really hard on is not important. It is. However, they're probably going to be looking at that and thinking, what out of all the hundreds, which one of these innovations or which one of these companies is going to have the most impact? And align with their incentives and what they're incentivized to do. So challenging those entities, those people, those gatekeepers, so to speak, how to ask the question of the innovator who's coming to them, the digital health company, who did you validate this on? What is this data? What are you basing it on? Because, like, for example, a lot of times you get the same pitch. So, we reduce, so use an example of something that's like similar, a normal pitch. We reduce, by doing this intervention, you can reduce someone going to the emergency department by blah, blah, blah amount percentage, and you reduce cost by this amount. And here's all the clinical evidence and the outcomes to validate that. And the organizations that are looking at that are doing the payer, the payer of that for that services, they're looking at that information. But I think historically, sometimes they've had blind spots and they haven't asked all the right questions. They haven't asked who did you test this on? What population? Well, if it happened in Louisiana, we're going to apply this all over the country. And we assume that it's going to scale and it's going to, in Massachusetts, work the same way. And when we have backlash in Massachusetts, then we're surprised. So I think it's just like creating, I think, and this was something that said, forums like this, where we have a diverse group of people coming together and talking, and then bringing up things like that to people. Because if you're sitting in your ivory tower, you're talking to your colleagues who talk like you, think like you, they may not challenge you on that. They may not bring it up, and it's not really out of malice or, someone's out to get anybody. It's really just a blind spot. So I think that, just us continuing to make our voices heard and bringing these things out to those that have the opportunity, letting the innovation be known, but also highlighting the benefit, but also going a step further than the standard, what you hear from everybody else. And helping them to be able to see what's the win in it for them. The win is that you now are you're investing in a product or a solution that is going to have multiple effects. And it also is going to be something that has been tested on populations and has delivered real results on populations.
When I think about feedback, for me, in the terms of AI, it's where you take your ground truth. How do you validate your AI model? If everyone is different, well, everyone should have a different digital twin. So it's hard to find a ground truth. And if you create a real digital twin of a person, two identical twins should have a different one. So you need to be able to differentiate that. And that's one of the challenge. And also when you stack up different AI model on top of another, they each have their own percentage of error, but those are cumulative. And at some point, so you have to be careful not to make a big leap and, start from the bottom and go step by step, but, with ground truth and feedback.
Feedback is an interesting concept in this business. Healthcare is a awesomely inefficient marketplace where you have government, insurance companies, healthcare providers, the pharmaceutical industry, and then patients, all with their own set of motivations, incentives, and end goals, which are somewhat disparate and competitive. And so all of those things, though, need to align in the same place and time for the next big thing to happen and be accepted by the industry. And so I think dovetailing with what you said, we're all entrepreneurs, and I am a recovering one myself. We all want to be disruptive, but in healthcare, I don't think that's a good word, honestly. We don't want to disrupt healthcare. We want to evolve it. And for things like AI, digital twins, the way you do that is with meaningful incremental change. As challenging and as painful as that is to say, the reality is you got to get in with that first claim, that first use case. You got to exhibit both clinical and economic value. We all want to do what's right for the patient, but doctors still have to be paid. The lights still have to turn on. Money is involved, unfortunately, and lives hang in the balance. And so I think the feedback needs to be, one, tangible, meaningful, and incremental, unfortunately, but you will get nowhere trying to take giant leaps, and we can make meaningful progress taking one step at a time together, hopefully.
So to build on that, digital twins, it's an evolution of personalization and segmentation. We're doing it now. And I think that's what I see in a lot of the AI technologies and the technologies of which we spoke. They really are evolutions, but we put fancy names on them. I'm not sure why. Like, I would love to go back to speaking plain English.
Well said.
But we are moving in increments, and I agree with you. And so I'm encouraged by that fact for all of us, anyone who wants to begin to experiment in that state. And I had a very meta thought, Tina, when you were talking, because imagine that you use digital twins as the means to run the what if scenarios to test the other different, solutions that are coming to you. So I think probably you guys just need to start with adopting digital twins.
Well, I thought you just said they already did.
Let me jump in. I think there's different level of digital twin. If you have a DNA test, in theory, it's a digital twin because there's a digital version of your biology that's out there. But that's different versus one day having a digital twin of every cell in your body, which would be tremendous. We're not there yet, but there's in between. If you look at what digital twin have done for industrial sector, aviation, every plane that we fly has a digital twin on the ground that tracks every data, that can simulate everything. So it's coming, and I think it's going to be a great revolution. The question for me is not if, it's really when is it going to be mainstream.
And as a quick sort of lightning round, and then we'll go to questions from the audience. I was curious about your thoughts about where there's greatest potential. And so something, you could either say something that other people aren't seeing that you think that it's kind of novel and you see where it's going next, or it could be completely obvious, but it's still the most important next step. So maybe starting with Mary Sarah.
To me first.
If somebody else want to raise their hand, you can come back. But yeah.
So one place that I see that doesn't get spoken about a lot, but is in the administrative. So we talk a lot about how we use it for care delivery, but technology and AI and like digital twin concept. But a lot of the inefficiency is based on the administration and the infrastructure that is built, and that's a lot of the pain point in the friction in the system. So some of the immediate value or some of the short-term value before you get to the point where you're actually able to apply this on patients at scale is in the administrative piece and improving that, improving those things behind the scenes And I think there's enormous potential there, and that can come quickly.
I have many ideas. It's a blessing and a curse. So I would suggest that digital twins, what some of the potential, certainly the highest potential, is in this area of mental wellness, mental well-being. Diseases that are better known, that are slightly less complex, are much easier, I believe, at least initially, to be able to show great progress in. But to me, taking the most difficult, the most complex of the disease stage, things that include the brain and any number of external factors, could really move us quite forward. I mean, just thinking about the trial and error that you go through with medication management for people with, some sort of mental health disease. You try them on one med, they have to go 4 to 6 weeks, and then maybe that didn't work, and then they have to suffer the side effects and the consequences of that before you try something else. So even looking at opportunities where you can combine the art and the science, but at least shorten some of those cycles, I think is huge.
In my case, I think the shortest, biggest win is early detection of asymptomatic disease. Pancreatic cancer is one I have in mind, which my neighbor died from unexpectedly. So I think that's a short-term one. In the longest term and longer term, biggest win, like Mary said, complex disease, neurological, like Alzheimer, would be one that would probably very be helpful.
Well, I guess my concept seems pretty simple in comparison. So I think so much in healthcare is really centered around behavior modification. I mean, that's what it all is how do we change behaviors and lifestyles? And so how can we use a digital twin to really put it in a patient's face, what their lifestyle can do to them, positive or negative? Kind of like when Credit Karma introduced their credit score simulator for different financial habits. What if you could do that for a human and say, okay, well, if you continue to eat fast food every day, you're going to look like this. But if you stop and take the stairs every day and play that out 10 years, this is what you'll look like. And I think playing on personal psychology and really showing what would otherwise be untangible effects of minutia of activities every day into what happens over time can have a dramatic effect on actually changing lifestyle choices. So a patient education sort of facet to it.
I just want to jump in real
For
quick.
$9.99, you can get
It's actually free, and that's our first application of BioTwin Lifestyle Medicine, where we give user result on 5 pillars of lifestyle medicine: nutrition, substance abuse. I said nutrition and fitness, sleep, and stress. And what we can do, we can simulate a 300-pound morbidly obese version of you, as well as Olympian athletes. We're not making revenues just to recruit user for a research project, but this is not, what's good is we're not telling you the risk factor. We're telling you this is your own biology, this is where you're going. So it really allows you to take it in your own hands. So fully agree with you on that.
You might have a deal.
And so I'll take questions from the audience. If anybody has any questions.
Yes. Joe, and then just not. Sorry, again.
I'm curious about the boundaries you're all drawing around your simulations, because when you introduce something to, say, a cell like a sugar, there's like you introduce one thing and you can watch that happen. But when you're looking at something complicated like an organ, we're talking about a liver, or like a whole person, we're talking about an ecosystem of both cells and the conditions that they're there. Are you also simulating the environment around those cells or that whole person ecosystem? Because that could potentially change things, especially if you're adding multiple factors, because everyone's life is, interacting with both air, water, as well as food, and you're not just getting that one single glucose molecule going to cells. Can you talk more about that?
Yes. So right now we cannot do accurate simulation because there's so many variables involved in that the result wouldn't be accurate. It's all about the ground truth. So we limit ourselves with what we can see, detect, and understand. So our current focus is metabolomics, which is sort of the biomarker at the end result of the body, and it tells us about environment, about nutrition, but it's all about ground truth. So we really limit ourselves about what we can confirm. So we had a few high elite athletes who gave us samples, so we can, we have a ground truth for elites. Same thing with the morbidly obese patient. But as far as stimulation, we have to be careful. It's not on the short term because it takes so much data, and the ground truth is hard. It's a slippery slope once you get there. So it's not the focus in the short term because we don't want to lose the credibility by risking doing one of those.
Thank you.
Okay, he stole my question, but you asked it much better. So thank you. So I just had one comment basically on David's idea for the app developers in here, the gamification you could do with a BioTwin and the what if scenarios is a really cool idea. And you talk about working with a patient and gaming and reaching different audiences. That would be fascinating. So get to work.
Great idea. Oops. Yeah.
So thank you. This is very interesting. I never heard this term until half an hour ago. So the question I have is, how does just a regular person get a BioTwinned? Is that something you could just ask your doctor for? And not only that, but how much does the patient have access to their own data?
In terms of BioTwin, if you're interested and want to support us, support our research, you can go on BioTwin website and you create your own twin. We'll send you a kit by the mail. It's completely free in Canada. In the US, you just need to pay for shipping back, which is something like $12. And we'll get it free in the US soon with shipping. And I think your other question was about the data. Right now, it could be you as a user that say, hey, I have my own digital twin. And let's say we get FDA approval for breast cancer screening. You can mention it to your clinician, or it might be your clinician that offers to you. It'll go both ways. There's a lot of question marks going that way as far as approbation. In terms of your data, you always own your data. So you
understand.
No.
That's what I was kind of scared. Okay.
Also, I also know of, so there are digital health companies that are selling into the market, population health or care management tools. So like employers might have, so there's like an example of a company called Twin Health that has a metabolic disease management digital intervention. And so an employer, they're marketing to employers, payers, so it could be a part of a component of your benefits. And how they use it, it's embedded in their intervention. So it's a part of their intervention. So they create using, I think it's like 6,000 biomarkers or 6,000 data points. They create a digital twin, and then they use that in conjunction with clinical care pathways that they've created to manage a person's metabolic health conditions. And so it can be something, they're one of the, in comparison, you look at like Twin Health might be a comparison to a solution such as like Livongo has digital health diabetes management programs, or Virta Health has a food as medicine type of clinical intervention to deal with or to be able to treat metabolic conditions. So they're competitors. They're using like different models, and then but payers, health systems, employers may be purchasing that, and it might be a part of your benefit package. If not, it might be something to bring up if you're interested. It might be something to bring up to your employer. It might be something to bring up to if you have any connection there, to say this is something that we're interested in, and they might be they may want to consider it.
I could see it delivered on the provider side too, especially for providers who are about to enter a value-based care model, where it could help not only the patients and their outcomes, but also help the providers be able to live in a world of value-based care without feeling or being concerned as though there's a group of patients that may be shortchanged. in a way. So it's going to be, it's like everything else. It's such a new technology. It is not really, it's not in the field. It's in a lot of clinical trials, NIH, Mayo, Cleveland Clinic. It's all over, but like everything else, it'll be slow to adopt. It will likely be adopted across multiple models, but you'll see it start to proliferate.
So you've got the digital twin, which is a noun, I guess, like the thing that you've created of a person, but it's not static. It can change and update as you have new data, and you can do so many things with it. So the verb of it is like we could do simulation training under many different environments, and then look at sort of a Monte Carlo analysis of the likelihood of each of those environments, and come up with more than one potential game plan simulation, how you can work around that. And then hence why I guess when I was thinking about feedback, it's like constantly putting out a new Bayesian prior, your prediction of the way this is going to go, and then you can kind of get feedback from the real world and update that perpetually.
Just want to add another one. QBio is a company in San Francisco. They're creating a digital twin from you using their own imaging system. So you'll have your own digital twin, but using imaging. And there's also Unlearn, but that's more for a clinical trial. That's also doing digital twin. They're all complementary. They're all using different type of data. At some point, we should all merge together what we do, because it's just going to make a more complete twin.
And Cindy, did you have
No, I think we're good. And
Okay.
wait, okay, we'll take one more quick question. I'll give you the mic. Thank you.
Thank you. This is Liz Lee with DX Innovation. So it's very interesting, bring back memory of like over 10 years ago, I was doing the research of developing artificial heart pump. And we actually, I developed myself we call it hardware in the loop, basically simulation of the entire cardiovascular system. But it's a very complex system, and we made tons of assumptions. That was over 10 years ago. And then that was before the term of digital twin was really created. And then it's very fascinating to know, like nowadays, what we can do. And you mentioned earlier the GE, IoT. Basically, they can embed over 10,000 sensors and create this kind of a sensor network to collect tons of data from IoT, industrial IoT environment. But based on my recollection, the human body is very complex. It's extremely complex. And then my question is, we talk about all kinds of essentially simulation models, whether it's a live twin or dead twin, right? And what kind of regulations we have to really say, well, this twin, this simulation modeling is basically, it's supreme than the others, and what kind of benchmarks we're using. Back to what the other gentleman was asking in the question earlier, because the human bodies is very complex system of systems. Thank you.
I'll just say thank you for your question. I believe governance is one of the biggest gaps we have in this area right now. Something that both the government and individual organizations are struggling with, rapidly trying to catch up to, and that lack of governance is also sort of stymieing innovation in the area, because in the absence of rules, people don't make decisions, honestly, and you can't move something forward because nobody wants to stick their neck out. And so I don't know if the other panelists have a better sense, but to my knowledge, there really is not a set of standards and governance in place today. We are doing our best, and the collective we as a society are doing our best to leverage the old paradigms of FDA approvals for really new technology that doesn't quite fit into that paradigm now.
Oh, in the interest of time, I think that should be our last question and answer. But thank you so much for the panel. This is amazing.